Well, if you're suffering from joint pain or back pain, like a lot of us do, Oahu Pain Care might have the answer for you.
Yeah, Dr. Pao is someone both my dad and I have visited in the past for a safe and helpful treatment.
So at Oahu Pain Care, we provide non-narcotic interventional pain procedures to help people who have spine-related pain. Sometimes we will send people to physical therapy. We'll use some non-opioid medications, and at other times we will use injection procedures to help alleviate their pain.
We're talking with Dr. Pao today, and a guy that I know very well because I've actually visited you and have undergone procedures with you, as well as my father. So thanks for being with us on Living It. I appreciate it. Let's go ahead and tell all our viewers your primary interest of pain management.
In pain management, what I'm primarily interested in is helping people to try and restore them back to their life that they was prior to their being suffering with pain, whether it be compression fracture pain, people with back pain or sciatic pain, or people with neck pain that release into the arms.
VCF, vertebrae compression fracture?
Yeah, vertebral compression fracture.
Why does that need to be treated?
Well, that needs to be treated soon rather than later, because what they have shown in the studies from 2005 and 2008, where they looked at all Medicare recipients who were over the age of 65, and they fell into three groups. The first group was treated conservative, which is bracing, using physical therapy and pain medications. The second group, they did what is called a vertebroplasty, where the physician inserted into the bone a needle and then injected bone cement. And in the third group, they did what is called a balloon kyphoplasty procedure. And with that procedure, they inserted a needle into the fractured bone, and then they removed the center part of the needle, and they inserted a balloon in there, and then they filled it up with a contrast fluid. And what they try to do is, usually when people fracture, they do a wedge fracture. So when you put the balloon in there, you try to restore the height back again, and then they deflate the balloon and backfill it with bone cement or crazy glue that they use for like knee replacements and hip replacements.
Wow, that sounds pretty complicated. So three different types of procedures. I know that I have one. I don't remember the one that the name of the one that I had with you where I laid down, but you do use x-rays to make sure that you're doing it safely. Can you tell us a little bit about the how you treat the VCFs?
The people where they just injected the bone cement, they lived about 2.2 years longer. And the people where they did the kyphoplasty, where they inflated the balloon, then placed the bone cement in there, they lived 7.2 years longer than the people who they just treated conservatively. Unfortunately, in Hawaii and in other places of the country, many people and doctors don't realize that treating the fracture is one of the best things that we can do. It's a one treatment that we can restore their lives, we can improve their ability to live alone, and we can save them from having other problems.
You're able to actually help patients in your office a lot of the time, aren't you?
Yes, I do the majority of my procedures in my office. And the reason for that is, we're able to control infection process, and we're not exposing patients to other places where they have higher, COVID type of infections that are kind of prevalent in the society. And we're not subjected to all the rules that they have as far as needing to have nasal tests into people before they come to the hospital for the procedure, so we can expedite things for them and treat them safely.
Doc, you have one more thing that you wanted to add that I found pretty interesting, and it's about it's regarding wearing masks. Can you tell me a little bit more about your passion about this?
Sure. So in America, we're having problems about people wearing masks. So if you look at our death toll, we're over 200,000 from COVID-19. And you look at Japan, if you corroborate their percentage of population to us, the death toll would probably be, as of today, 4,100 people. So people say, what's the difference? The big difference is basically in Japan, everyone will wear their mask. So they did a study at Hong Kong where they had 3 cages of infected hamsters, and they had 3 cages attached to them who were healthy hamsters. So in the first group, they had a fan blowing from the air from the sick side over to the healthy side. In that group, 67% of the healthy hamsters got coronavirus. In the second group, they put the masks around the healthy hamsters, around the cage of the healthy hamsters, and then they had the fan blowing across. In that group, 25% of the hamsters got sick from coronavirus. In the last group, they put the masks around the sick hamsters, and they found out that 17% got sick. So what this study adequately provided was that if people who are sick wears the mask, it'll kind of protect the rest of the community. So if everyone wears the mask, we can significantly reduce the amount of COVID-19 we have. So I have two offices. I have one on Oahu, and it's Oahu Pain Care, and the phone number there is 531-7222. And I also fly to Hilo on the Big Island once a week, and the phone number there is 933-7222.
All that information we'll have on our website, k2n2.com, shortly after the show. Doc, thank you so much. I'm glad that I haven't really had to see you recently, but I'm glad that I'm seeing you now, and for you being on the show. Thanks.
Great. Thank you so much. Take care. Be safe.
I know he's scaring a whole lot of people previously with the whole bone cement comments, but they've got some procedures that are just amazing, and you can see some of the captions. And then, of course, his final thought: wear your mask.
Exactly. And you know what? There's nothing worse than chronic pain, too. I mean, it's hard just as the older you get to get up and everything. So thank you so much for doing that and for sharing those options for everyone.
Yep.
Okay, a little earlier on to our